Good evening. My name is Dr. Larissa Estes-White, and I am the Executive Director of All in Alameda County, a countywide anti-poverty initiative focused on ensuring Alameda County residents have access to a quality education, economic opportunities that promote self-sufficiency, and basic needs for shelter, safety, healthcare, and food. I'm also a member of the American Cancer Society San Francisco Bay Area Board. I'm excited that the American Cancer Society is partnering with Chef Nelson to build community and explore topics like access to healthy food and cancer outcomes. Our gathering this evening is so important because food insecurity is a long-standing issue in Alameda County. We want to address not only food insecurity, but nutrition insecurity. It's not enough for people to have access to any type of food. It is important that it be healthy and nutritious. We've learned that food insecurity occurs on a spectrum. Pre-COVID, nearly 20% of Alameda County residents exhibit some level of food insecurity. And there are clear racial and ethnic inequities within food insecurity. 25% of those reporting food insecurity in the county were African American, and 30 were Hispanic. It is important to note, though, that those statistics can often hide disparities within a population. In 2020, some local research found that 61% of the Mam-speaking Mayan population was food insecure, compared to 39% within the broader Latinx population. COVID-19 has exacerbated food insecurity in Alameda County. The Alameda County Community Food Bank's helpline call volume has increased 1,000% and has been persistent at 1,000% increase since March of 2020. Lack of access to healthy food is a significant predictor of poor diet-related chronic disease outcomes. For example, food insecurity increases the rate of diet-related disease significantly. One out of 5 households served by the food bank include at least one person with diabetes. We've witnessed the triple burden of food insecurity, diet-related disease, and now poor COVID outcomes disproportionately impact Black, Indigenous communities of color. And because of this triple threat, people of color are more likely to be hospitalized and suffer from poorer health outcomes. Finally, we want to recognize and promote that food is medicine and can improve the health and quality of life of those living with cancer. Limited access to quality food influences the quality of life and health outcomes of cancer patients. Research shows that there are important relationships between cancer outcomes and food insecurity. For example, cancer patients may have increased nutritional needs due to metabolic changes. They may be vulnerable to food insecurity due to financial strains of their illness, and this may lead patients to have reduced access to high quality and nutritious food. Finally, persistent and new food insecurity is strongly associated with foregoing, delaying, or altering cancer care. Compared with food-secure patients, food insecure cancer patients have statistically significant higher levels of nutritional risk, depression, financial strain, and a lower quality of life. What's more important is over half of food insecure patients reported not taking a prescribed medication because they couldn't afford it. Similarly, the Life After Cancer epidemiology study shows that consuming nutrient-dense food decreases the risk of death for cancer patients. In this study, researchers analyzed patients diagnosed with early-stage breast cancer and showed an increased adherence to a diet that included high intakes of fruits, vegetables, whole grains, and poultry, significantly decreased the risk of death. Addressing food and nutrition insecurity, especially among people living with cancer, can impact their health directly as well as indirectly by ensuring that they don't have to choose between medication or treatment and feeding themselves or their families. We are so grateful that you've joined us this evening. Special thanks to Chef Nelson, and please enjoy the East Bay Gala, and thank you for supporting the American Cancer Society.